then the Lieutenant Governor, and then we'll open up for questions. So, Tom, if you're ready to take it away, it's all you.
Thanks so much. What we saw last night was absolutely stunning in terms of the speed of a flip-flop on an issue that affects the lives of millions of Virginians. Ed sat on stage and tried to signal opposition to what is an absolutely disastrous Graham-Cassidy bill, and within minutes of leaving the stage, something happened. We don't know if he got a call from Donald Trump or something else, but within a matter of minutes, it abandoned this kind of flirtation with moral leadership and gotten back on the party talking points. And I can just tell you as a Virginian, I really am concerned about someone running for governor who seems more worried about upsetting Donald Trump than upsetting 840,000 Virginians who might lose their health care. And, you know, it's one thing in political debates to talk about the back and forth of what was said, but we have to realize this is playing with real human lives. We're talking about reintroducing the issue of discrimination based on pre-existing conditions. We're talking about over $1 billion in Medicaid funds to Virginia. We're talking about an elimination of Planned Parenthood funding. Experts have called this the most radical replace bill yet in this effort to undo the Affordable Care Act. And so, you know, this is a moment in elections where people are looking for moral leadership. They want to know where somebody stands. And when Gillespie stands on stage and tries to have it both ways and signal that he's opposed to this bill and then flip-flop on that just minutes later, that really speaks not just to a person's policy positions, but kind of where they're taking their marching orders. And I think it's important in this context as well to understand that this has really been a bipartisan opposition to the Graham-Cassidy bill. You've seen Republican governors put their own citizens ahead of their partisan commitment and faced some heat from Donald Trump for it. We've seen Republican governors in Nevada, Arizona, Ohio, recently Maryland across the Potomac, speak out against a bill that would be disastrous for states and disastrous for families. And here's Ed Gillespie, who's asking for Virginians' vote right now and still seems, again, more worried about upsetting Donald Trump than upsetting the lives of families across Virginia. So this is a life or death issue in Virginia. We're talking about the Medicaid expansion that covers addiction services, mental health coverage, and I think the contrast last night was so clear. On the one hand, you have in the Lieutenant Governor a practicing doctor who understands the stakes in our healthcare system and was absolutely crystal clear in his opposition to this disastrous bill, crystal clear in his willingness to fight for the Medicaid expansion that could affect 400,000 lives, 400,000 families across Virginia. And on the other hand, you had someone who couldn't even show the courage to take a single position over the course of a night. So I think it really crystallized a lot of what this election's about. You have in Dr. Northam someone who's really focused on what Virginia needs, what solves problems in Virginia, and on the other side you saw a political pro trying to speak out of both sides of his mouth on issues that are incredibly relevant at the kitchen table across Virginia. So I was very proud to see the Lieutenant Governor's leadership last night and very distraught to see a stunning flip-flop on behalf of Mr. Gillespie. And with that, I'll hand it over to Dr. Northam.
Thank you, Congressman Perriello. I appreciate you joining the call, and also to all of the rest of you that are on the call. We thank you. I know it's a busy afternoon. You know, last night my opponent seemed to get a bit confused on where he stands on the latest version of Trump Care making its way through the Senate. And while on stage, he seemed to understand the detrimental impact that this would have on Virginians. And he said, we can't punish Virginia. And in his view, the Graham-Cassidy falls short of that. Yet afterwards, and I, like Congressman Perriello, I'm not sure what happened between the time he was on the stage and when he got to the reporters afterwards, but he said he wasn't endorsing or opposing any specific legislation. So here's what we know. Ed Gillespie has been Donald Trump's top lobbyist for taking health care away from over 800,000 Virginians. Mr. Gillespie owes it to the Commonwealth to come clean that taking health care away from Virginians is his priority. This is far too important of an issue to not take a stand and make it clear to Virginians whether you support Trump Care or not. They deserve to know that. The Graham-Cassidy repeal plan is a last-ditch effort, in my opinion, to take away care through the same damaging, secretive, and partisan approach. In fact, the legislation will cost in the ballpark of $1.2 billion. I also heard his plan last night to cut taxes for the rich at the expense of the working class, $1.4 billion. That's almost $3 billion that he'll put Virginia in the hole. We can't let that happen. In Virginia alone, an independent study shows 839,000 Virginians stand to lose their health care coverage because of this bill, and that's just morally wrong. I have taken care of too many sick children and their families over the years, and as I said before, no individual, no family should be one medical illness away from financial demise or really, in this case, death. And that's what happens if people, especially with complex medical conditions, don't have access to a provider. So like prior Trump care bills, it would jeopardize protections for those with pre-existing conditions and force Virginians to pay more for less care. Previously, Mr. Gillespie has said he's open to Medicaid waivers. At last count, we have over 10,000 folks waiting for these in Virginia. And with the Cassidy-Graham allowing changes to essential benefits, Virginians deserve to know whether he would keep things like maintaining substance abuse use disorder treatment as an essential health benefit. And even Virginia Republicans felt compelled to send Congress a letter when they previously discussed block granting Medicaid. Why? Because it's bad for Virginia, forcing us to cover fewer people, reducing care, and making up the cost by cutting other state programs. So last night, I spoke about treating a beautiful 7-year-old girl with cerebral palsy. I saw her out at the Wise Ram Clinic. She needs a governor who will stand up for her, as does her family. I asked Mr. Gillespie if he could look her in the eye and tell her and her mother that they don't deserve the same health care Mr. Gillespie has for his family. His response was not to answer, but instead say the Ram Clinic, which serves people that Mr. Gillespie wants to leave without insurance, doesn't think Obamacare helped in Virginia. Well, he's wrong again. What didn't help that little girl and her mother was that people like Mr. Gillespie oppose expanding Medicaid to over 400,000 working Virginia families. Healthcare shouldn't be about who has money and who doesn't. That little girl wasn't born to money, but she deserves to be healthy and have the same opportunities as Mr. Gillespie's children. I believe that, but he doesn't. So people should not be one illness away from financial demise. For Republicans to push this plan through simply to prove that the extremes of their base, they can bring back zombie legislation from the dead, is wrong. This isn't about politics. This is about people's lives. Instead of cutting access to care for working Virginians and undercutting the ACA's protections for those with pre-existing conditions, we should be expanding Medicaid in Virginia and working on bipartisan solutions to stabilize the individual markets. It's why I've called for a bipartisan committee to develop recommendations for how Virginia can maximize federal dollars. There's no reason that 400,000 working Virginians should be denied help. Or should we be willing to give away billions of dollars, as we have since January of 2014, to states we compete with simply to provide a political point? Just yesterday, Governor Hogan from our neighboring state of Maryland forcefully denounced this bill because it would hurt Maryland. Governors Charlie Baker from Massachusetts, John Kasich of Ohio, Brian Sandoval of Nevada, and Phil Scott of Vermont, all Republicans, have been willing to stand up to the president when a proposal would hurt their states. Mr. Gillespie has said he would be clear when he disagrees with the president. He should be clear with Virginians where he stands now. The people of the Commonwealth deserve straight answer, not speaking out of both sides of their mouths. I will turn this back over to Ophira. Thank you all.